to End Homelessness. I'll be moderating the question and answer portion of this webinar. Your presenter today will be Kay Mosher-McDivitt, the Technical Assistant Specialist at the National Alliance to End Homelessness. We also have the pleasure of having Kathy Robertson here to welcome you to the webinar. She is the Associate Director of the Homeless and Special Needs Housing at the Department of Housing and Community Development. Very quickly, we're going to take questions at the end of the webinar, but you can feel free to type them into the questions box. You'll see that's highlighted in red here on the screen at any point in the webinar, and we'll answer those questions at the end. I should also say that the webinar today is being recorded, and we will send it out to all of the participants at probably tomorrow. So thank you so much for joining us today, and I'll turn it over to Kay.
So, good morning, and again, like Anna said, welcome to our webinar today. So here's the agenda. As you all know, this is about the Rapid Rehousing Certification, and the reason that we decided that we would do a webinar when we first released the certification information, I think it's been a year and a half, close to 2 years ago. We actually did a call, and since that time we've gotten some applications that have come in, and we've learned a lot about what what the issues are that people may or may not understand, and we just thought it may be helpful to actually go through the application and point out some of the areas that folks have been having a lot of questions about so they can help you in sending in your application. We really want to get organizations certified. We have 2 organizations so far in Virginia that have been certified. So that's the reason we're having the webinar today. So here's the agenda. First, Kathy's going to talk a little bit about Virginia's commitment to rapid rehousing, and then I'm going to give a basic certification overview to sort of go over the reasons for the certification, who can apply, how you need to be thinking about applying, and then I'm going to go through each of the application components. Earlier today, Anna sent out a link to all of you this morning to the actual certification, the actual application. And if you haven't already gotten that, if you can pull up that email and actually be able to look at the application, I'm going to refer to the different parts of it, and that may help you, particularly if you have a specific question. You can enter that question in as we go through that. So then at the end, as Anna said, we're going to open it up to any questions. You're muted now, but you can type your questions as you go, and then at the end we'll answer those questions, and I can always flip back to a screen if there's a particular area that you need to know. So that being said, I should also say we expect the webinar to last an hour. There's a lot of you on the call that I've worked with over the last several months with the Learning Collaboratives. Anna and I have been working with you, so those of you who've worked with me know that sometimes I can talk a lot. I also talk very fast, so I'm going to try to slow that down in the webinar, but our goal is to definitely be done within an hour, so you can all go and have lunch. So I want to turn it over to Kathy. This is really part of the Reducing Family Homelessness in Virginia, the rapid rehousing approach, and many of you have seen this. A lot of the work that we've done that you're getting from the Alliance or the Virginia Coalition to End Homelessness, DHCD, is all part of this collaborative with our 4 organizations that have really worked together in the last several years to really focus on how do we use rapid rehousing to reduce family homelessness in Virginia. So that being said, I'm going to turn this over to Kathy. Kathy, go ahead.
Kay. Okay, thanks, Kay. We're really excited to have our friends and partners from the National Alliance here this morning to talk about the Rapid Rehousing Certification. As you know, DHCD and the Commonwealth are very committed to rapid rehousing. It is one of the 5 strategies of the state's homeless plan. It's a best practice model that has proven to be very successful nationally and in the state of Virginia. I'm sure most of you know this, but just to reiterate, there's been a significant decrease in homelessness over the last 3 years, from 2010 to 2013. We had set a goal of reducing homelessness by 15%. We actually exceeded that goal, and homelessness reduced by 16% overall during that time frame, and 17% for families. We really attribute a lot of that success to the implementation of the rapid rehousing model. Over those years, we've moved from a significant portion of funding, of state funding, from just shelter ops to rapid rehousing, and the number of providers has increased significantly. Back in FY 2011, I believe, we had like 4 providers doing rapid rehousing. We now have over 68 providers doing rapid rehousing. So we want to ensure that we continue that momentum. And to that end, we want to encourage more providers to look at the rapid rehousing model. We want to ensure that communities as a whole are looking at rapid rehousing. And we also want to encourage those providers who are already doing some rapid rehousing to hone their methods and skills around it. So that's part of why the whole certification process was developed and why the Alliance did that. So to encourage that, we are in this upcoming application, which will be a COC-based application for state funding, not to be confused with the current HUD-NOFA that's out there, but the application that DHCD will be releasing probably in early February sometime, there will be bonus points for communities that have at least one organization or multiple organizations in their COC that is has received this certification. So with all of that said, I want to turn it back to Kay so that she can really get into the meat of the presentation. But again, thanks to the Alliance for doing this, and we have been very, very successful with the rapid rehousing model, and we want to ensure that that momentum continues. Thanks, Kay.
Thanks, Kathy. So here we go. Kathy gave a good overview of how the certification fits in, how rapid rehousing as a strategy fits in across the state, and the impact it's had. And a number of the organizations on the call have also participated in the learning collaboratives. And for those of you who have not, you still probably know about this. We've sent a lot of information out. We are on, today is the last day of the Rapid Rehousing Challenge that all of those organizations have been involved in. There's been 31 organizations across the state that have participated in the learning collaboratives and in the Rapid Rehousing Challenge, and it's been really exciting to see the leap forward that Rapid Rehousing has taken in the last 100 days, and all the organizations, getting excitement and just really putting forth the practices they learned through the learning collaboratives. And one of the things that we said when we started the learning collaboratives, it was that our goal is at the end of the learning collaboratives, it was that those organizations and other organizations across the state would really be able to focus on their strategies within their programs to get their certification. So that being said, here's a certification overview. So the Virginia Rapid Rehousing Certification, right now it's just for the state of Virginia, was designed by the Alliance to help providers, your funders, and other stakeholders across the Commonwealth to identify the qualities of effective rapid rehousing programs. And what we want to be able to do is determine which providers are providing rapid rehousing assistance effectively. So the certification focuses on identifying organizations that quickly rehouse households while reducing the risk of future episodes of homelessness. And since the certification is part of the collaborative to reduce family homelessness, we're currently certifying programs that provide rapid rehousing for families. If your program only provides rapid rehousing for singles, you can complete the application. However, we're going to give priority to programs that are serving families. So I wanted to make that clear because I know there's a number of organizations that serve only singles. So I have on the screen some bullets that just to be aware of the kinds of things that you need to know about. So this is for programs that are rehousing families, and it certifies individual providers or a community application that brings together providers as a collaborative. But what we're looking for is programs, providers, or communities that are proficient in providing best practice rapid rehousing. And again, coming back to that last bullet, that this is about quickly rehousing households as soon as they become homeless. So here's the 3 things that I want to say as you look at the application is that you have to be certified in every single thing that's on the application. In some cases, we are getting applications that have some sections filled out, but then other sections aren't completed. People are sending in saying, well, you know, we don't have the data, but we are doing this. We can't certify you unless every single component, all 5 parts of the application are completed. And also, there's different sections on the application where it talks about we need to have your documentation, and I'll go over that more in depth as we go through this. But all of that has to be included with the submission because we aren't going to review part of it. So this goes on to number 3. We're only going to review completed applications. So if there's any missing documentation or there's missing answers, we're not going to review what you sent us. And you can't get a partial certification. We're going to let you know. We'll get an email back to you, let you know what you need to complete. But our hope is that after today's webinar, we won't need to do that, that in fact you're going to have everything completed. So then the next big thing is who should apply. So initially we saw this as being individual organizations, but recently we've had calls from a couple of communities that are doing this as a collaborative where they've come together and there's maybe one organization that provides financial assistance, there's another organization that's providing the landlord housing search, and then there's other organizations that are there are the shelters that the folks are coming from. And so, sorry about that screen coming up. So what we're saying is that you can apply as a community collaborative, and I'll talk slightly about that. But from an individual organization, these are the questions you need to ask yourself. Number 1, are you a 501c3? And if you're applying as a collaborative, again, are the agencies a 501c3? And are those agencies, and has your agency been incorporated for 10 or more years? Now, if in fact you've been incorporated for less than 10 years, we're not saying don't send that in, but we need to know when you were incorporated. But we're looking for organizations that have experience and a history of doing these activities. So we also want to make sure that you've served at least 30 or more families. We need data on at least 30 or more families. And again, the reason for that is we're looking for a pattern. And if it's only been a few families, we really don't have a sense of is this a program that has an extended period of time and enough data to be able to certify and know that this program is doing what needs to happen. And then, do you have at least 1 full year of outcomes for all of those families, for those 30 families? So if we talked to some programs that had not been doing the program for a full year, and so what we would say is if you have not been doing a program for a full year, then you want to wait until you have data, because part of the housing stability and the outcomes we're going to talk about later requires a full year. And then the last thing that is the most important thing is that you need to be an organization that is an active participant in your local continuum of care, and you also need to be submitting on a timely basis all of your data in your community's HMIS. Now, obviously, if you're a DV provider, you need to be collecting data with the same standards, because we're going to need some data backup as we go through the standards. So if you can answer yes to all of these questions, then you should be applying. I want to say again that we really encourage, if you're a community collaborative, and we believe that that can be a really cost-effective and efficient way of providing rapid rehousing, rather than having 6 or 7 organizations that are applying within a community, that it might make a lot more sense for you to really look at how do you do rapid rehousing in your community and apply as a collaborative. Okay, so now the application, and this is where if you have the application, you just might want to take a look at it, because this is where I'm now going to switch over and go through the actual application. So part 1 is the easy part, and that's on the first page of the application, and this is where Part one is just your demographic information. We need the name of the organization, the address, and then we need the contact information for the individual completing the certification. But what I want to say is that we want to make sure that whoever is completing the certification is the contact that can answer any questions or clarify any issues that we have on the application. So it's important that the person that's that actually puts their name down as a contact on there would actually be able to understand the program enough to provide the data and give the data that I'm going to need to find out about if, in fact, I don't understand an answer on the particular application. So that's the easy part. That's part one of the application. And then as we go on now, we're going to go into the standards. So the next part is, and I have a lot of papers in front of me. I actually have the application in front of me as well, so I can talk about. So again, now on this slide, these are the 4 certification standards for best practice, and these are the parts 2 to 5, and you have to respond to all of these. And this is where I said before is that you need to be providing all of this and have all of this information in order to be certified. And so there's some necessary activities. We're going to look at your program outcomes and data. We're going to look at your program orientation, and there's surveys that we're going to need you and your staff to complete. And then you're going to have to certify that you follow certain best practice program policies. So part 2 is the certification standard for necessary activities. In order to be certified as a rapid rehousing program, you need to be providing all 4 of these activities. You need to have a landlord recruitment and housing search approach. You need to have be offering short-term financial assistance. It should say assistance, not services. You need to have home-based case management with voluntary services. As the follow-up case management after folks are placed in housing, and you need to have a housing barrier assessment tool. So you need all 4 of those activities, and you either need to, as an individual provider, provide that service internally within your organization, or you can have a formal agreement with another organization. Say perhaps that there's an organization in your community that has the financial assistance. You need to have a formal agreement, a formal arrangement with that organization that they will provide the financial services. So I'm going to break this down a little bit and go through this. So the first thing is that you have to have either on staff or through a formal relationship with the organization. You need staff who recruit landlords and encourage them to rent to homeless households. And this landlord outreach function is really important, and this is what results in landlords that will reduce their barriers to homeless households accessing rental units. We often hear that it's very difficult to get landlords to rent, and so it's not just a matter of having being able to just call somebody on the phone and saying I need housing, but that there's actually someone on your staff or you have a partnership with an organization that's responsible to leverage these landlord partnerships, develop these relationships to help families overcome the barriers so they can get into housing. You also should be able to identify specific landlords that are your landlord partners, that there's a specific function and that you actually have landlord partners with your organization. So this one thing here, don't forget to attach a copy of the job description of the person responsible for this activity. We are going to review that job description, so we need it to be clarified. Sometimes we get just a bunch of job descriptions that are attached that actually don't show us who is responsible, and sometimes reading through the job description we can't figure that out. So, obviously, if you have a housing search specialist or a housing specialist in the title, that makes it very easy. But if there's someone else on your staff that has other responsibilities, that's one of the questions we ask on this is, do they do only housing search or do they do something else? You want to actually answer the questions on the application itself first, and then you attach a copy of the job description, but make sure we're clear which job description you're using that goes with this. If you have have a formal agreement with another agency, we would like you to attach that memorandum of understanding or partnership, whatever it is, and still attach a copy of the job description of the person that's doing your landlord outreach. We are finding job applications that come in and, said this is the person responsible for landlord outreach, and yet there's nothing in their job description to indicate that that is a function. And since this is such an important component, you need to have a job description or a partner agency that has a job description that is very clear that this is a function. And then you need to make sure you attach that. So that's the landlord outreach component. The next activity that you need to provide is financial assistance. So, the question is, do you provide short-term financial assistance? So again, a provider must provide either directly or through a formal agreement with another organization or agency financial assistance for housing costs. And those housing costs can include rental deposits, first month's rent, last month's rent, and short-term rental assistance. On the application, there's a checklist saying what do you provide of these, and you don't have to do all of those, but you need to have short-term financial assistance available. That's the model of rapid rehousing, that there's short-term, 1 to 3 months, and I know that DHCD, if you have their ESG funding, has some specific policies and procedures around that.
I'm sorry, can I just interrupt?
Yes.
Next time that box comes up, just select the option to keep your current color scheme, and then it won't keep popping up.
Thank you so much,
I think some of our attendees are getting a little distracted by it.
Okay. Sorry. I don't know where it's coming from. I never saw it before on this PowerPoint, so thank you. Okay, so the short-term financial assistance, you just need to check off what you provide. And again, maybe you provide some and you still have a partner agency. If you are partnering in any way with another organization to provide some of the assistance, again, let us know that. And then the final question on this section is, we say, what is the total amount of financial assistance your program provided over the past 12 months? And what we want to make sure you do is that you are answering it for all sources, all of the resources you have, not just your funding from ESG or not just your funding, from DHCD. A lot of times, so now I need to say, I'm going to keep the current, thank you. That should not come up again. All right. Sorry about that. So, so again, back to number 3 on this slide. If you have, other funders or you have money in your budget that you're using for financial assistance over the past 12 months and you can give us a calendar year for that, or you can use the past, 12 months. If you're sending this application in the beginning of February, you can take January of 2013 to January of 2014 and just give us that flat number of the total amount of financial assistance you provided in your rapid rehousing program. An example of another source of funding would be in the Fredericksburg area, that there were organizations that over the holidays did a home for the holidays drive instead of the Adopt a Family, and they raised, last count, I think it was around $50,000, $60,000 specifically to help with rental assistance or the short-term financial assistance. So, that money, if they're, applying, if the Fredericksburg area would come in and apply for the certification, they would look at all of their funding sources, including that money that was used for that financial assistance in the past year. So this is from all sources, not just a particular grant that you got. And we know that many organizations are providing and use a lot more resources, and we're only looking at the actual financial assistance, not your other costs. That comes later. If there's questions about that and clarification, make sure you send that question in, and I can bounce back to that. So then the next of these 4 activities that you need to provide is home-based case management. So the question you need to ask yourself is, does our organization provide home-based stabilization case management? This is after folks are placed. And again, we want the job description for this. So you need to be able to provide the home-based follow-up case management services, and these are the services that will link your program participants with other community services like child care, employment, education, and also this is the follow-up case management is also that mediation. You can intervene in conflicts between the landlord and program participant. Again, we're going to review the job description to assess the responsibilities as they connect to home-based housing stabilization, home-based case management. And again, sometimes we are seeing job descriptions that we can't tell that this person is doing anything around rapid rehousing and stabilization case management. They're reading basically like a shelter-based case management position. So we need to be clear that there's a different function. This is very different from what shelter-based case management is, and we want to make sure that your organization is providing it to be certified. So again, don't forget to attach a copy of the job description for the person responsible for this function. Let me mention that I don't think this happens very often, but there may be a situation or a community that actually does not provide this follow-up. If there's another organization that has home-based stabilization, I actually think of Fairfax. That might be one of the communities that has another function that's a community-wide function of home-based case management. And if that's the case and your organization doesn't provide it, but you are partnering with another organization that does that follow-up case management with families after they're housed, again, we want to see what that agreement is with that organization, and we would want a copy of the job description of the person responsible for that. And then the last activity is a housing barrier assessment. And so this information comes directly from the application in another area when we're talking about outcomes, because we want to know, are the participants you're serving high barrier, do they have high housing barriers, medium housing barriers, or low housing barriers? And I want to also say that often when I talk to people, people will say, well, everybody we serve have high housing barriers. But then when they start really breaking it down and looking at this, they realize that in fact that's not the case, that they don't have high housing barriers. In most cases, we're finding that a majority of the applications that have come in, the participants have medium barriers. You're going to see these listed here, and low barriers. But we want to make sure that you have a housing barrier assessment that's an assessment not to screen people out and determine if people are ready for rapid rehousing, because those of you who have been participating in learning collaboratives or have heard other things that we've done across the state, is that rapid rehousing is a resource that can be used for anyone, and the people should not be screened out of rapid rehousing. But the purpose of doing your housing barrier assessment is to determine what kinds of what is that intensity? What's the housing search going to look like? Because obviously someone that has all of these barriers over here, like they have no income, they have a lot of previous evictions, previous episodes of homelessness, the things that show up to the landlord, it's going to take more time probably to help them find housing. And they're going to have a lot more barriers to maintaining that housing. So we want to make sure that you're very clear that it doesn't mean you shouldn't be rapidly rehousing those persons. So we're looking for good assessments that are assessing for housing barriers, not housing stability about who can maintain their housing, but rather the housing barrier assessment up front. And again, your housing barrier assessment does not need to look like this. It was just to help you sort of see the kinds of things that we'd be looking that you're assessing. We also know we just do it in 3 levels. We also know that many of you might have 5 levels. We've seen assessment tools that come in with 5 levels, and that's perfectly fine. As we get to the next session, I'll talk a little bit about how to interpret that. But again, this little check mark down here, sometimes we get an application and there's no barrier assessment tool. So again, we are not going to look at an application unless your tool that you use, either you use it, it's your own that you created, or there's a community-wide tool that's been created that you're utilizing, and we need to have that included. You also need to let us know if it's your own tool, and that's a question you're answering on your application. Again, this is all in part 2 of the application. So that's everything you need to know about part 2. Now I'm going to go on to part 3. And I would say that this is the section that most folks are having problems with. I don't think we've got any application that we haven't had to go back to folks and clarify. So I'm hoping that by today, talking about this and looking at this, that it can help clarify what we're asking for in these 4 different areas so that you can send us the correct information. So part 3 of the application are your program outcomes. So again, this is where we need you to submit data on at least 30 households, 30 families served in your programs. So for small programs that don't, serve a lot of families in a year, you don't have to do all of these families in 1 year. You can give us cumulative data. We had a program that we looked at that gave us data over, I think, 3 years. And that's fine, but we just need to have data. We need to have complete data on all of those households over all of those 3 years. And one of the things that we're finding is that some programs, when they go back to maybe early years of HPRP, that they may not have the data they need on those families to report it. So it's fine that you give us, if you have 10 families you've served a year over the last 3 years, that's fine. You can submit your data on those 30 families. You can submit your application based on the fact that you've served those 30 families. And then you need to just let us know that, but then you have to give us data. So you're going to have to give us 3 years worth of data because we're going to be needing to see the data for all 30 of those families. So you're going to have to go back 3 years and pull your data. So in the questions 1, 2, and 3 on these standards, we need data from all of those 30 families. Again, for questions 1 through 3, I meant 2 as the word T-O, 1, 2, 3, but then I realized those are also the numbers. So in addition to answering the questions, so these questions are going to be on part 3, and we're going to have each of these, and we want you to actually enter the percentage in, so, or the length of time. We want you to either put the number there or the percentage after each of these questions on part 3. But then we want you to have either, if you can run it directly yourselves from HMIS or get your HMIS administrator to run the data on these households. Please don't send us the names of people, but just, we need to know that this is family. Some people just do it by family 1, 2, and 3. Others have, a number that goes with it. That's fine. We just don't want to have the names of the families, but we need to see a report that's run from your HMIS system that substantiates your data. Now, obviously, for programs, DV programs, since you don't enter your information into HMIS, you can't get that out of HMIS, but we need you to also submit a report where, whatever report you run, where you can show us that you are tracking this data. We need some kind of data report to accompany your application so that we can see, in fact, that you have backup data on the actual answers that you're giving us. So now I'm going to go down into each one of these. So the first, and once again, you have to meet the standards for all 4 of these areas that we have on here. Meeting just one of these standards does not get you the certification. All of these standards are important because, again, meeting each of these standards shows us that you understand rapid rehousing and you're providing the program that we're looking for. So the first is the length of time it takes to rehouse participants, and the standard for the application is 45 days for the certification. That's an average. Some families will be less, some will be more. For those of you who provide shelter, you need to look at this from the point someone comes into the facility. So it's from the point of entry into the facility to their exit from the facility. However, there's some programs that are non-facility based. They take referrals from shelters. Obviously, they can't, start doing rapid rehousing if somebody doesn't tell them about it. So for non-facility based programs only, the length of time is from the date of the program referral to the permanent housing placement. Again, this is about rapid rehousing, quickly rehousing families. And so, someone who, is not getting referred to a program until, an internal program until they've been in a program 100 days or, there's other kinds of determinations being made, then that would not be a best practice rapid rehousing program. This is about exiting people quickly as soon as they enter programs. Again, the reminder, we need your HMIS data. Then the second is permanent housing exits. So this is, and again, what gets confusing for some people is that, they take the exit date that somebody exits from their shelter into permanent housing. This is about your rapid rehousing program exit date. So this would mean when the household exits from the rapid rehousing program services, not when they leave your shelter or your transitional housing program. So you need to look at everybody that was rapidly rehoused, and then where they close an HMIS to rapid rehousing program services. They're getting no more financial assistance. They're getting no more follow-up case management. So they may have been out of your shelter for a year, but they were still getting rapid rehousing services. The exit date that we want you to report on is how many of the families that were initially placed in rapid rehousing in permanent housing, which most of, that's the purpose of rapid rehousing. How many when rapid rehousing closed its services, how many were still in permanent housing? So you want to, again, put the actual percentage on the application. And again, this is reported on households, not persons. And so what we want to know, again, here's this thing on going to the barrier categories. This is where you go back to that earlier barrier slide and you look at the families and determine how many of these fit these barriers. So, if everybody was moderate, then fine. But if it's like, okay, we served 30 families, 10 were high barrier, 10 were moderate barrier, and 10 were low barrier, we need to know that. Because as you can see from the application is that the standard is different depending on the barrier level. Because with higher barrier families, we lowered the standard slightly than from low barrier families because, again, we recognize that when you're working with higher barrier households, you may not have the same outcomes. So that is very critical to this. And then that you also, that this is the same thing again, so once you give us that number on the household and identify, so again, when you run that HMIS report, it can be as simple as just, highlighting the, somebody that meets the high barrier criteria that we included the application with perhaps red, the yellow, the yellow can be the moderate barrier or the low barrier can be green like I put in the colors, or you can just put H, M, or L next to each person's number, each person's identifier, so we know how many families. Sometimes we get the same data for the last slide for permanent housing exits and housing stability. These are two different things. The last slide was about when they exit the rapid rehousing program. This is 12 months after they exit the rapid rehousing program, not again your shelter, but when they're no longer open to rapid rehousing services. How many become homeless within a subsequent 12 months? So say they exited your shelter, in June, and then in August they were actually close to rapid rehousing services. Their exit date would be the August date, and then August of the following year would be when you would go back and look, did that household become homeless? So this is where you need to be providing a program for a period of time so that you can give us this housing stability. And this is not necessarily what did somebody need a little bit more assistance 6 months later, because sometimes people do need more assistance. This is, did somebody become homeless? And homeless defined as they were entered into your HMIS system as becoming homeless, entering a shelter program. They've been identified as HMIS as they re-entered and become literally homeless. This doesn't mean they have to be in the same housing that you put them in 12 months later after the program closes, but you just need to look at, and this is where your HMIS data comes in, is that your HMIS administrator can pull this. They can pull that identifier and see if that person re-entered the homeless system a year after they exited the rapid rehousing program. And then the last one is program efficiency. See this little guy up here? The reason he's up here is this is the most difficult measurement for folks to get. We are finding that a lot of people are saying, well, we got $50,000 from DHCD, and they use that amount of money. However, they may have only used that for financial assistance. This is about including all your program expenses, the financial assistance, all of your staff costs, any administrative costs associated with this program, any overhead costs associated with this program, any office space, technology. So say if you're 100% rapid rehousing, then your entire program cost from your executive director, down to your development office, you should be submitting your whole budget if the only thing your program does is rapid rehousing. If, however, like most of you, rapid rehousing is just a piece of what you do, so maybe it's like 20% of what you do. So you would take all of your, the easy stuff is your financial assistance and your staff costs. But then what are all of the overhead associated costs? So, like what part of the executive director's cost should go in there, and your financial person and all of that. So, some organizations with some help have said, well, it's about 20% of our total budget, so they just take 20% of all of those costs and their office space costs. We need to see the budget of what all of the costs are associated with a program. This is so we can compare apples to apples across a program. And then, so say your whole budget ends up coming up to, $200,000, and see if I can do this quickly, and you've in that year, 1 year, you've rapidly rehoused, and this is for families that are housed, not for people that haven't been housed yet. You've actually rapidly rehoused 20 households in that year. This is not persons, and that's the other thing. Sometimes people say, well, we had 20 households, but it represented 60 people. You don't divide it by 60. It's by the household, not the persons. So we want you to give us that cost, but then we also want you to submit the budget that you base that on, because that's our trigger to let us know whether you maybe or miss some costs that should normally be associated with a good rapid rehousing program. So I expect you to have some questions about this, so please submit those. And now I'm going to go, the last two slides are pretty quick slides because they're the easiest ones, and then we'll go to questions. Part 4. There is a survey that's on here. Everyone connected to the program must complete the questionnaire. Definitely, we want one from the executive director or the president of the organization. We want a questionnaire completed by any program manager or supervisor. If there's other program staff responsible for program policies, developing program policies, that person should also be answering the questionnaire. And then every direct service staff, all of those that are associated with the attached job description. So again, if you're partnering with outside organizations, obviously, their orientation impacts your program, so we want them to complete the survey as well. And we don't need to have people's names on there, but often we just get one person completing the survey, and we know that unless there's only one person working in your entire organization, you're a one-person show, there's other people in your organization connected with the program. We need the questionnaire filled out by every single person connected. Look at this list, make sure you're covering that, and submit it with all of those. So here's your little don't forget reminder down here. I sort of try to do these reminders so if you don't listen to anything else, you can go back and look at these things. So submit all your questionnaires. And then the last one is part 5, and this is the shortest part of this whole application. So in addition to meeting all of these standards we've gone through, the necessary activities, your outcomes in part 3, and then your orientation in part 4 as administered by the surveys, there are several practices that a rapid rehousing provider cannot engage in to receive rapid rehousing certification. So services have to be voluntary. So one of the things that your program cannot do is require that participants engage in specific services. Now, obviously with ESG, there has to be at least a monthly case management visit, but it's a matter of a check-in with the case manager. It's not dictated you must do A, B, C, and D as designated by your case manager, but rather there needs to be a connection with case management. That's to make sure you're not just putting people in housing and then not following up with them. However, this is about voluntary services, so you cannot require them to, for example, go to so many meetings or go to so many job interviews in order to get the financial assistance or other services of the program. And the second thing is that leases that program participants obtain must be identical to the typical leases that any other renter in the community would obtain. So you can't have additional requirements like drug testing for program participation. So again, the property owner has to give this person the exact same lease as they would give any other renter in their community. And then we ask that the person responsible for the program, either the executive director or the program manager, initials each of these things. They're listed on there, and by initialing this, you are verifying, and we're taking that as your verification that in fact your program does not participate, does not make people sign additional leases or contracts that they must abide by in order to keep their apartments, and that they also are not required to participate in these certain services. So, oops, I went too far. Just quick reminders. Those are the 4 components of what you need to get in. Those part 2, 3, 4, and 5. So again, I suggest you read through the whole application before you start to make sure that in fact you have all the information you need. Again, all standards must be met for certification, and all 5 parts will be filled out in order for us to review it with all of the requested attachments. And then remember, you have to include the HMIS report to substantiate your outcomes, or for DV providers, you need to, and that's the only exception if you're a DV provider, then you need to submit some kind of, data from whatever resource that you do. And again, as you're filling it out, and people have been getting better about doing this, call ahead of time or email us with questions, because it's easier to answer them before the application comes in so that you can get it into us the correct way. So we're at 45 minutes, and so now I want to open it up to any questions that you have. So I'm going to turn this over to Anna at this point.
Thanks so much, Kay. We have a lot of excellent questions, and some of these may be things that we've already covered in the webinar that you submitted before we answered it. So, so this may be a little bit of a review for some people, and I apologize for that. First question we have is, are there standards that we can review to determine whether or not we'll meet the standards for qualification before we apply?
Yes. In fact, if you look at what Anna sent out today, both places on the application itself, particularly around the outcome standards, we are very specific about the standards and the data that we're looking for. And so there's actually an explanation when you answer those questions of how to answer them, but there's also another form that she included that is an overview. And please read the overview first. And I should have said that, is that when you, and there's this link, DHCD has it, it's on our website too. That link has been sent out. There's 2 documents on that link. One is the application and one is the overview. I suggest you read the overview first, and the overview is very clear about what outcomes we're looking for and what the standards are. So for each of those outcome measures, what the standards are, and there's also the standard for the housing stability and exits is also the cost, the fair market rent of your housing. I forgot to say that. If you could include on your application, I apologize if you heard that screeching noise. There's something going on outside my window here in D.C. I think it was a horn. So to go back to what I was saying, when you go to those sections on questions 2 and 3 in the outcomes part, if you could put on there what a fair market rent of a 1-bedroom unit is in your community. Otherwise, I have to look it up, and I can look it up, but it just makes it easier. But that's the FMR that most of you probably know what that is and have easy access to that. If you can include that. We also look at program efficiency as well as your other outcomes based on the FMR. Because obviously a program that has to put out more rental assistance is going to cost more. So those are the 3 things that we need to know. I think that answered the question, is that on the application there's some instructions, but I suggest you look first at the overview, the Rapid Rehousing Certification overview, and print that out, or online, just look at that, and it's very specific what the outcomes are that we're looking for certification.
Thank you. Could you provide a definition of home-based case management?
So home-based case management means that, in fact, there are home visits. That is part of the best practice of rapid rehousing, that home visits, because people are now in their housing, and it's, and often they don't have transportation. This is about rapid rehousing is about making it as as convenient for folks to stay housed as possible. And so if people are busy looking for jobs and looking, for all the other things they need to stay in their homes, or they're working, what we want to make sure is that part of the program is that the follow-up services that are provided are offered within the home, so that that case manager can go out and visit the family in their home and don't require people to come into an office as part of the participation in case management. We also know that that is one of the key elements of getting landlords to rent to folks. So a best practice program, part of selling it to the landlord is, hey, we're going to be going out and checking on the folk, visiting with them, so we're going to know if there's, problems with the unit, and it allows us to have a better sense of what's going on in the household, because sometimes landlords are, based on previous eviction histories. Maybe they were evicted because, other people moved into the household with them, or there were damages to the property, and that's how you can mitigate some of that stuff, the fact that your program will be offering home visits. So I think that's the piece of the home-based case management. It's not about, making people show up at an appointment in our office at a scheduled time. It's about a best practice program is really about doing whatever we can to help families stay stabilized in their own homes, and the follow-up case management home-based is found to be a best practice in that model. Thank you.
We have two questions about whether or not you have to be a 501c3 to apply. So do you have to be a 501c3? And kind of another take on that question is, if we're a community collaborative that does rapid rehousing and the lead organization, this collaborative, is a unit of local government, can we be certified as a community?
So the answer to the first one is yes, you do need to be a 501c3 to apply. And then the second question is, if a unit of government is applying, they can apply on behalf of the participating organizations, but then the other organizations that would be applying need to be 501c3s. I think that answers the question, because obviously a unit of government is not a 501c3, but the programs that they would be, the providers they would be working with need to be 501c3s.
Thank you. We have a number of questions about the 30 families requirement.
I figured we would.
Yes. So here's your first one. We have 30 families, but they were not all exited 12 months ago. Is that okay?
And that's going to be, this is where I'm, I wish I could give a clear black and white answer. If the majority of them have been exited, so that so if it's 30 and the majority have been exited and you have data, so you should at least have the housing exit data. But the housing stability data, if we at least, for the majority of them, you have housing stability data, so that you have the 12-month data, then that we'll take a look at that. But if you only have housing stability data on 5 out of 30 families, then that is not going to help us to know that you're doing the follow-up services in a way that people are staying stabilized. So we need to see at least the majority of them stable after 12 months.
Do the 30 families...
So Anna, you're listening to this. Do you think that was clear enough?
I think that was as clear as we can be.
Okay, thank you.
Do the 30 families need to be served over the same 12-month period?
No, and that was one of the questions I did answer earlier. Obviously, some of smaller organizations, smaller communities, you may not have 30 families that are homeless in a year. We know that from our learning collaboratives that, some communities don't have as much family homelessness as others. So obviously, this is not about making more families homeless to be able to rapidly rehouse them. That, that's not what this is about. So obviously, so you can go back, and so over the, there are people that are going back and using 3 years of HPRP plus the 2 subsequent years since HPRP has been over, and giving data to us because they've only maybe served 5 or 6 families each year over the course of those years. So yes, it can be cumulative years. They do not all have to be served in the same year. But then you are going to have to know that you have to still be able to pull the data on those families that were served several years ago and include that in your submission from HMIS.
This question may be implicit in what you just said, but just to be clear, this organization has some families that they served before they offered all of the services that you require. For example, they didn't used to do landlord outreach, but they do now. Can they count those 30 families?
Yes. There would be no reason not to do that. I mean, and we'll be able to see if it wasn't effective if you don't have the outcomes for those families. But so, obviously now you have to be doing landlord outreach, so we're looking for that you're providing all those activities now, but go ahead and include the data from the families before that you served. We would probably see if there wasn't the, ample follow-up case management, that we might see that the housing stability numbers wouldn't be there. But obviously, if you rehoused people and didn't have the landlord outreach and just were sort of shooting from your hip then and then realized, well, we got to do this in a better way, yes, absolutely. Go ahead and apply and you include those families.
Great. And this is our last question for the moment anyway, on the 30 families. Some of the families that this organization served in their 30 families exceeded the state's asset limit requirements. Is that okay? And I think, Kathy, if you're still there, you can feel free to jump in on any of these questions if you'd like.
And I'm really, that is a question that never has been asked. Obviously the goal of rapid rehousing is to house every family that's in a shelter. And so if a family comes in, to a shelter and they're in an emergency shelter and you're rapidly rehousing them, obviously you can't be using DHCD resources and ESG resources to house that family. But if you've used other resources to house that family, then yes, you can include them, but you need to make sure that your budget and your financial assistance shows the resources that you used, because that's where you obviously have to be using resources from other funders in order to be able to do that. So you would have to include, you should be including all those resources anyhow, but it becomes even more pertinent that you include all of those resources when you're reporting that. Kathy, does that?
Yeah, no, that makes perfect sense, Kay. And just to piggyback on that, the funding that flows through DHCD, while there is that asset issue, and I understand that, the recertification, that doesn't apply if they are homeless in the beginning. I mean, well, let me back up just a second. This gets so complicated. But it applies at recertification. It does not mean, what it means is that you cannot be providing them financial assistance. It does not mean that you can't provide case management.
Correct. And it doesn't mean you can't provide financial assistance when they're in the shelter for the first 3 months.
Right. Correct.
Okay, but if somebody needed financial assistance beyond the 3 months and they didn't meet that asset level, you would have to be using other money to provide that financial assistance. And
of course, we would contend that that money that they're building up, that rather than building a savings account, they should be paying for some of their rent would be what we would contend.
Yeah, and that's not just from the state's perspective, that's also a best practice. That's one of the things we talked about in the learning collaboratives, is that households should be paying, using as much of their income as possible to pay their rent.
And it goes back to providing as the least amount of financial assistance possible.
Correct.
To ensure that we can serve the most number of people.
Correct.
Thank you. This is an excellent segue to a number of questions we've received on the financial assistance requirements. And so I know you answered this question already, but just to clarify, do organizations need to report financial assistance paid with HSG is the question. But also this begs the question, which financial assistance sources do we need to report?
Okay, so, and then Kathy, you can jump in. So this is only about rapid rehousing. So this is about rehousing literally homeless families, and so the definition would be that they need to be literally homeless as defined by HUD, which is the number 1 and 4 definition. So number 1 definition is they're in a shelter or living in a place not meant for human habitation. So this is not about using dollars for people that are doubled up and meet some of the other HUD definitions, because that's where the the other dollars can kick in. So you need to, when you're we need to see this is somebody that was in a shelter bed and exited a shelter bed, not exited their, mother's home and went into it, because that's not the definition of rapid rehousing. So this is rapid rehousing is just for people that meet the HUD definition of literally homeless, and then the DV, but also, it's a number 4, so it's the victims of domestic violence, but then also find themselves, and so basically this is somebody that left their home, not because they couldn't stay there any longer, due to financial reasons, but they left it for domestic violence, but they end up in a shelter or in a place not meant for human habitation. So that's the definition of eligibility for rapid rehousing. So being very clear that this is not about that other, pool of people with the other definitions that we can serve with other resources. So that's the first clarity. But then the second one is, and then all financial resources from any funding, if you have, donors, if you use donor money. I know that some people just took money out of a line item and said, we don't need to be providing this maybe particular service within our organization anymore. Instead, we're going to use this and add to the financial assistance. And it might be donor money or a grant that they've gotten. Whatever funding source, this is not just about, your state, federal money. Specifically targeted for rapid rehousing. This is about any financial assistance that you use, that your agency provided to these families that you're talking about, that you're reporting on.
Thank you. So this next question is, if some of our clients are high barrier, is it okay that we provide more financial assistance? And is there a limit to how much financial assistance we should be providing to families?
So I'm going to go back to what Kathy said. And so in any rapid rehousing program, it's about providing the least amount of assistance necessary. And so, one of the things that we really encourage, best practice programs to do is that you don't just automatically say, well, we're going to pay everybody's rent for the first 3 months, 100% of their rent and, security deposit. It should be and this is some of the things that we trained in through the learning collaboratives. It is about a case-by-case basis. And so, one family, may get a lot less assistance than another one because they have some more resources. So you should be looking at all of those resources. So the only limits on the amount of time of rental assistance is what your funder tells you. However, you're going to be able to serve more families, and part of what's going to happen is if you look again at the certification review, the rapid rehousing overview, people with high barriers, one of the things, and that's where it's going to show up in your program efficiency, because that's where not only all of your other program costs, but your financial assistance will go in there, and that's where, in fact, there's been some programs that have not been certified because the amount of financial assistance and the length of time it was provided was so high that, in fact, the cost was way above, the certification standards. So yes, we do recognize, if you look, there's a different level. If you're serving high barrier people, the efficiency cost assigned to high barriers and assigned to people from high cost communities is higher than for low barrier and low cost communities. We factored all of that into the standards. So there's not a limit, but it's really about realizing people have a lot of tenacity and people are very resourceful, and sometimes we think that we need to give a lot of assistance when in fact people do better with a shorter term assistance and really understanding and recognizing that they're going to have to find a way to maintain their housing and are much more motivated to get jobs and do what they need to do to be able to sustain their housing than depend on this long-term subsidy that then suddenly just goes away after a year, and now they're sort of back to square one. But a shorter-term subsidy, we're finding people are much more successful in maintaining their housing because they get from the door that there's work they need to be done. And that's all that follow-up case management, making sure that people are getting connected with the services they need to do to maintain that housing. Kathy, do you need to add anything to that?
No, I think that certainly explains it, and it goes back to what we were saying, about just about the whole asset and the whole savings account and all of that. While we understand why providers would want to help people with that in that way, it may not be the best thing.
Mm-hmm. And I do see that we're like at 12:07. If questions are still coming in, a lot of people are on. I'm more than willing to continue to answer questions, but I also recognize that people, you know, we said an hour, and we're now at an hour and like 3 minutes since we started, so I'm willing to keep taking questions.
2 or 3 more questions, and then we can end the webinar.
Perfect. Okay.
So the next question is about the housing barrier requirement.
Mm-hmm.
Is it okay that our housing barrier assessment isn't in HMIS? And additionally, does our scoring on our housing barrier assessment need to match that of the certifications?
Okay, so the question is it okay if it's in HMIS?
I'm sorry, theirs is not in HMIS.
No, the actual assessment tool does not have to be in HMIS. So if you have a tool but it's not in HMIS, but you're using it, that's fine. Now the second part of so I think I answered that is that I do know that there's some communities that have put the assessment tool right in HMIS, but there's a lot of folks that haven't done that yet. That's fine. You just send us a copy of what you're using when you're doing the assessment to determine what the housing barriers are that this person's going to have, so that you know how to rapidly rehouse them. So the second part of the question was, again, Anna?
The second part of the question is that does the housing barrier assessment that the program uses need to match the housing barrier scoring on the certification?
Okay, so here's where it's sort of this two-part thing. So, so in general, we're going to look to make sure that a barrier assessment tool has some alignment with those things that we had on there, so that because this is about, again, making sure that we're looking at each organization the way we look at each one, so that we're not that somebody isn't saying, well, all of our people are high barrier because their assessment tool is making everybody high barrier, and another organization is saying, no, that person's actually a low or moderate barrier person. So we want to make sure there's some similarity, and so that's why we put those standards out there of what would indicate a high barrier, a moderate barrier, low barrier. However, we do know that people have maybe 5 areas, 5 categories, and that's fine. And so, some people, I know there's some communities that have a level 4 and 5, and those are the ones they indicate as high barrier, are the 4s and 5s, and maybe the 2s and 3s are moderate and the 1s are low. So, so you just need to sort of look at what you're putting in those barriers and make sure there's some alignment with those 3 areas. However, then when it comes to the outcomes, those are the standards you should be looking at to say, this is what our people look like that we served, so that Agency A's outcomes are being held to the same standard of barriers that Agency B's outcomes are. And that, that may sound a bit confusing. I'm not saying you have to create a new assessment tool, but there should be some alignment. And by the way, we're finding that almost everyone that we sent in, there is alignment. We haven't seen any tool that comes in that has not already aligned in some way with these standards that we've put out. It's just more how they interpreted. There's some communities that decided 1, 2, and if they have 5 categories, 1 was low, 2 was moderate, and 3 was high. And then when they align it with ours, they're going, oh, wait a second. When I report this, actually, I need to look at my 4s and 5s, and I didn't have any of those. So my 3s that I considered high, really, for this report and this data should be, I need to report it to the certification as a moderate. But in terms of the actual tool, we have seen that the right questions seem to be on most tools that have come in.
Okay, great. And for our last question, could you share publicly the organizations that have been certified?
Sure. So Good Shepherd Housing in Fairfax, Virginia, and 4 Kids in Norfolk. In Norfolk, Virginia are the 2 organizations that have been certified.
And we should probably also say congratulations to those organizations for being our first 2 certifications. And thank you to everyone for joining our webinar today. Thank you to Kathy for participating in our webinar and helping us answer some questions. And thank you, Kay, for leading this helpful webinar.
And I have the slide up here with my contact information, so be sure you contact me if you have any more questions. Thanks.